There's one thing Donald Trump has always failed to realize: he removes people from office once they disagree with him, and that creates resentment. Once Trump's actions become the subject of a House hearing, he can stop officials and aides from testifying, but he can't stop disgruntled officials, aides, and staffers. There was a whole parade of them last fall, leading to the president's impeachment in the House. Now that his actions during the coronavirus pandemic are being called into question, he can stop the officials and aides still in the fold from testifying, but not the people he recently removed from office. One of those disgruntled employees is Rick Bright, who within the last couple of weeks was relieved of his duties as the director of Biomedical Advanced Research and Development Authority, having held the position for 4 years. He now has a more narrow as part of a bold new plan to improve COVID-19 testing at the National Institutes of Health. In his whistleblower complaint, he said he'd been trying to warn about the novel coronavirus since January and suggested putting treatment and vaccine development on the fast track. He also asked for additional N95 face masks but said that fell on deaf ears. In Thursday's congressional hearing, Bright claimed early inaction, mostly by the HHS, had cost lives. That inaction has put a lot of lives at risk in our frontline healthcare workers, he said. He contends he pushed for production of medical equipment, including masks, but that his direction was ignored for months, as he was told officials didn't think there was a critical shortage of masks. I pushed that forward to the highest levels I could in HHS and got no response, said Bright in his testimony before a House Health Subcommittee. From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act. Even today, the country is dealing with the consequences of that early negligence, he said. He believes healthcare workers are still more at risk than they should be. Lives were endangered, and I believe lives were lost, Bright testified. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not, he added. He claims he was moved to the lesser post because he objected to Donald Trump pushing hydroxychloroquine and chloroquine. Trump talked about it often, though after the Food and Drug Administration allowed it to be used in some situations, a study showed that patients that had the drug were more likely to die. The FDA is now warning healthcare workers not to use the drugs. My concerns were escalated when I learned that leadership in the Department of Health and Human Services were pushing to make the drug available outside of this emergency use authorization, to flood New York and New Jersey with this drug, he said at the congressional hearing. Bright believes the administration wanted to make it easier for infected individuals to use the drugs without medical supervision, even, strangely, people who may not even have COVID-19. I believe part of the removal process for me was initiated because of pushback that I gave when they asked me to put in place an expanded access protocol that would make chloroquine more freely available to Americans that were not under the close supervision of a physician and may not even be confirmed to be infected with the coronavirus, he testified. Trump wasn't just pushing the drug but pushing his idea of a timeline for rolling out a vaccine as well. I think we're going to have a vaccine by the end of the year, he said shortly before Bright testified on Thursday. That doesn't even match up with what Dr. Anthony Fauci, a member of the White House Coronavirus Task Force and the nation's top infectious disease specialist, has said about a vaccine. He's looking at a 12 to 18-month timeline. Bright said Thursday that's still more optimistic than reality. I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so, he speculated. Overall, Bright believes the government needs to respect its scientists more, noting that right now the response has been held up by not having a single point of leadership. We need to install and empower leadership, and we need to unleash the voices of the scientists in our public health system in the United States so they can be heard, and their guidances need to be listened to, he added. And we need to be able to convey that information to the American public so they have the truth about the real risk and dire consequences of this virus. Bright furthered this by stating, "We don't have a single point of leadership right now for this response, and we don't have a master plan for this response. So those two things are absolutely critical." Fauci has said recently that states that move toward reopening before meeting Centers for Disease Control and Prevention guidelines are risking new outbreaks, and that could lead to a setback for the overall response. Bright's testimony was just one day after Fauci and other health officials testified before the Senate, also with some strong opinions regarding the government response to the pandemic. But Bright's testimony, since he had already been pushed out, was viewed more harshly. HHS Secretary Alex Azar, while standing with Trump on the lawn of the White House, said, "Everything Bright is complaining about was achieved," adding, "Everything he talked about was done." He says he talked about the need for respirators. "We procured respirators under the president's direction." Azar added his voice to the Republican chorus asking why Bright has not been at the new post he was reassigned to. "While we're launching Operation Warp Speed," he said, "he's not showing up for work to be part of that." Bright contends he was on leave while he was dealing with very high blood pressure, blaming that on the events swirling around him. "I had a conversation with my physician about my hypertension and how we've been managing it over the last 3 weeks because this has been very stressful. To be removed suddenly without explanation from my role and position was a life change for me," Bright concluded.